up there. My old title when I started the program was Family Outreach Specialist, which essentially meant I led my agency's efforts in recruitment of new foster parents and adoptive parents to work with our agency. And as part of that work, I created an African American outreach initiative in the Seattle area, to recruit more African American families. I'll talk about disproportionality in a minute in our state. But seeing everyone else's numbers so far, I think in Washington State, black kids are overrepresented at higher rates than anyone else has presented so far today, which is really surprising and alarming to me, but that means we have to work harder to fix that issue. So initially my project was around best practices in recruitment of black and African American foster families and adoptive families. But due to due to a change in position that was not of my volition, our agency decided to end our outreach program, and so I was tasked with move back to the clinical team, which I started my work on for the agency. And so luckily at that time there was a supervisor position on my old team, the foster care team, so I was able to apply for that and move back to kind of the foster care team where we work directly with our foster parents and our youth in our program. So due to that change, I kind of changed my project to assessing kind of barriers for, and I intentionally sought out for black families in the process. We had a pretty dynamic case of a black family about a year or two ago that ended pretty badly. And so this is very much needed for our agency to see kind of what's going on and what we can fix to make sure our process is welcoming to all. But as you see, it says black, indigenous, and families of color. As I dug into the data and looked at the demographics of the black families that we worked with, they are very multiracial. And so I wanted to be inclusive of everyone's multiple racial and ethnic identities in the process. So that's why I expanded my title a little bit there. All right, so I guess I'm the only one that didn't put my big pico on here, but my research questions that I focused on, what are the barriers, and I'm gonna say BIPOC for the rest of the time, so that's a long mouthful, experience in the process of becoming foster and or adoptive parents, and then kind of based on the barriers that I found in my research, what can agencies do to better serve these families, and a lot of it's going to be Amara specific, but I think it's very generalizable to other agencies who do the work like we all do in this room. So why is this important? Why should we be focusing on it? Like I said, African American kids are overrepresented in our foster care system in Washington State. So they're about a little over twice as likely to enter foster care compared to their white counterparts in our states. So this equates to about 16% of the children in foster care identifying as black, African American, or multiracial black. And that's equal to about 7% of the general state population. And then in our state, about 7% of the foster families in Washington have at least one parent who identifies as black or African American. And I will say, if the general population of the state is 7%, black folks are stepping up to become foster parents at the same rate as other groups. But given disproportionality, if we want to make sure we're meeting the cultural needs and having homes that look like them, we need to, the black community has to step up at a higher rate given disproportionality. And so MIPA, it was talked about earlier, that part of MIPA is that agencies are required to recruit families that look like the kids in the state system that they're in. That was not happening in Washington. It really isn't still happening. I had my African American Outreach Initiative, but unfortunately that was ended when my position was ended, and so we've gone back to not having anyone really doing diligent work in the black community to get more foster families. So some of you may be aware, but in 1972, the National Association of Black Social Workers wrote a pretty powerful position statement essentially saying that they are not in approval of black kids being placed into non-black homes for adoptive purposes. And I thought, given the historical context, it was important to talk about that today, of why I believe it's so important to have black foster parents. And I think, so the paper, it was a reaction to the increased number of black kids being placed into non-black homes. And they're basically saying there's a certain set of tools and knowledge that black families have that they can pass down through generation to their children. and non-black families do not have that historical context and knowledge to pass on to our children, and that was a concern of their paper. But they also said black families can foster and adopt our own children, but the system has too many barriers in place for black families to get through. And so the paper also called for the field of social work to change practices, amend practices to make them easier for black families to get through the process, and especially kinship families. We know black families have been taking care of our own without the foster care system for generations, but the formal system wasn't really recognizing that and putting too many barriers for those relatives to foster or adopt their kin, and so that was a big part of their position paper as well. And yes, this was 1972, so people can say, well, that was 40 years ago, whatever that was, but I think the current historical context is still very valid. So yes, MIPA says we cannot delay a kid's placement based on race, and I'm not saying we should do that, but I think we need to hold up the second part of MIPA to recruit families that look like the kids in care. So we know obviously that transracial families do exist, and the research shows that in order for a child to really have a positive racial identity in a transracial placement, there really needs to be a commitment by that white foster or adoptive parent to want to cultivate that identity, but that agencies and states need to give those parents the resources to do so. And I don't think that's happening across the board. I can talk about my state. I think we have a required training at our agency, and part of that is focusing just on parenting across racial and cultural lines. But I know in our state, we're the only agency that has that required training, and so I know in our state, not all families are getting that, and I would assume that's happening. It's pretty inconsistent across the nation. And then why also is important to kind of figure out what are the barriers for black families. A lot of research has shown that that clinician-client relationship is really important. So the idea of social worker assessing my family throughout the process, if there's not trust and kind of cross-cultural communication and understanding of my culture from that social worker, that process is going to be impeded, and it's going to be a lot harder for families to get through the process and become approved for foster care and adoption. And then there's just a lot of research that has shown the child welfare system is just inherent with systemic and institutional racism, and just wasn't ever really set up to support black families to get through the process. And so based on that, I'm assuming there are barriers, and so that's what I was seeking out to see what are those barriers, because I think based on the research, we know there's going to be barriers for black families to get through the foster care and adoption process. So my goal is to really figure out what those barriers were. But quickly, who are we at Amara? So we are a nonprofit based out of Seattle, Washington, but we have 4 offices. So we have one in Seattle and then one in Tacoma, which is like a suburb of Seattle. And then we have 2 what's called emergency sanctuaries. So these are our King County sanctuary where Seattle is located. That one was just recently put on our Seattle property, but it's a place for kids just being removed from foster care, and they can go there any time of night, 24/7, and just really kind of eases that transition into foster care. In our state, we have a huge shortage of foster homes, so we don't have enough foster homes to take in all of the kids that are in our system, and it's really, I think, highlighted at that initial point of entry, and so we've had kids sleeping in hotel rooms, going night to night in hotel rooms, and then all day, in the state offices while the state's trying to find placement, going back to the hotel room, or going to what's called receiving care, so they may have 4 different placements in the first 2 weeks. And we just thought, if we're going to do so much to uproot these kids' lives, the least we can do is kind of soften that trauma. And so the emergency sanctuaries attempt to do that. So it's very short term, about 3 to 5 days. We have therapeutic child care specialists on hand. Like I said, 24/7, open holidays and weekends, and just kind of softens that trauma while the state can figure out what's that next best plan. A lot of the kids do go back home, which is awesome. Some go to relatives, and then some will go into more of a long-term foster care placement. So we've got 2 of those. We also have a great post-adoption program, which is fairly new in our agency's history, and really just to meet the needs of post-adopt families. Unlike a lot of your states that I'm learning, we don't have a state-funded post-adoption program. So it's really up to agencies or nonprofits to kind of do that work just out of the good of their heart, but it's not a kind of standard thing in our state, and so we created that program to kind of meet the needs and kind of fill the gap of services in our states. But like Amara, been around since 1921. Started off as an orphanage. So we've had a big history of really being more of an adoption-focused agency. So we used to have what's called the Relinquished Infant Program, or domestic infant adoption. So if a birth family was wanting to make an adoption plan, they would come to Amara, and then they would pick one of our waiting foster adoptive families for the placement of their baby. We no longer have that program, and kind of with that, we made a switch to really center foster care at the center of our work. Most of the families that we work with still have the end goal of adopting a child just through the foster care system. So we do tons of adoptions still, but we really make sure our families understand reunification first, really supporting first families. And if it goes to adoption, that we really support open adoption. And our post-adoption program is really successful in making sure our adoptive families honor those relationships with the birth family. At any given time, we're working with about 200 foster families at our agency. Okay, so kind of what did I do for my methodology? So I kind of did two different things. I did case reviews of BIPOC families who closed their file at Amara in the last 5 years for anything but an adoption finalization. So anything that the file was closed prematurely before the family got to kind of the end point of adopting. And then I also created a survey that I sent out kind of assessing barriers along the process for BIPOC families. So I sent that to every family of color that we worked with at Amara in the last 5 years. And then Amara has 3 different Facebook pages, so we posted it on there. And then PACT, which is a group out of, I think, Oakland, somewhere in California, does a lot of work to ensure kids in color needs are being met. They have a Families of Color Facebook group, and so they sent it out through their Facebook and email list as well for me. All right, so for the case reviews, we had 19 cases where the family's file was closed prematurely, and then I dug a little bit deeper, and really we only had 22 families that fit that total, so there was 3 families that adopted, and I looked at that family too, and there was, it's not in here because I did it after, but there was nothing alarming in those 3 families that adopted as well. But what I'm focusing on is the 19 cases of families that closed prematurely. And just to note, 8 of those families were working with the social worker that identified as a person of color. Demographics, though, of those families, 5 were single families, 14 were married or partnered, 7 were LGBTQ families, and 12 were heterosexual. 1 was a kinship family, and 18 were what we call traditional foster care, so they had no prior relationship to the child that they were caring for. And just to note, 2 families had previously adopted kids from the foster care system and they came back to adopt more kids. And then I'm going to give you the racial breakdown. It got really hard to put this on a slide because there's a lot of multiracial stuff and it was really hard to present it, so I'm just going to read it to you. So for the single families, there was 5, 3 identified as Black or African American, 1 identified as Black, Hispanic, and Latino, and he was actually kind of Afro-Caribbean is how he identified, and then 1 identified as Black, white, and Native American. And then of the couples, of the 14 couples, 1 family, 1 partner was Black, and the other partner was Japanese. 1 partner was Nigerian, and the other partner was Filipino. Another family, 1 partner was Black, white, and Korean, and then the other partner was white in that family. There was 2 families where both partners identified as Black or African American, and one of those families actually identified as Canadian, Jamaican, and Haitian. And then there was 9 families where 1 partner identified as Black and the other partner identified as white. And within that, of the Black partners, 2 also had Jamaican heritage, which is really interesting for Seattle to have 3 families out of 19 that had Jamaican heritage. I thought that was fascinating. I don't know how but that was very fascinating to me. But as you can see, we had a lot of diversity in how Black families exist in Seattle. All right, so why did their case close prematurely? The majority closed based on family circumstances, and I'll get to the next slide. I'll kind of talk about what those circumstances were. Others closed, the next biggest group, post-disruption or reunification. And I'll get into that in the next slide. Some were closed due to inactivity by the client. 2 expressed not wanting to foster or adopt as their path to creating family anymore. Wait time was another one for a family. 1 was dissatisfied with the service. 1 was other, and then 1 was kind of a mutual decision between us and the family. And I'll get into some of those reasons why. So yeah, 8 families closed due to family circumstances. And these were really couple moved out of state, so they were never from Seattle. They came for work and they wanted to move back home to be closer to family before they started the foster adoptive process. One family is a single guy, started the process single, then met a partner and started dating someone. It was getting serious, and he realized that he probably should put that on pause to see if this new partner, where that was gonna go, and if that new partner wanted to be a parent. And so he closed his file, and he said he'd come back if and when that partner, and they decided to parent. One family, they did a lot of remodeling on their house, so they applied and then stopped, did one round of remodeling, came back, and then realized they needed to do more remodeling, did that, and then they just decided that it was just not the right time. So it was really kind of everyday circumstances that the families were closing. 5 closed after experiencing a child reunify or disrupt from the home. Like I said, a lot of our families do have the goal of adopting. I'm a foster parent myself. I've had kids reunify from my home. It's heartbreaking. But for families that really have that end goal of adoption, maybe they've had infertility in their lives, those reunifications really hurt them emotionally, and they can't see themselves going through that again, and so they decide to stop after maybe they have a child reunify. And for those that disrupt, I think they had kids with behaviors that were beyond what we knew at the time of placement. As you know, that happens. And they just decide foster care is not the right thing. I don't have the skills to parent kids with a trauma background. Like I said, 2 families decided to pursue other avenues. I think one of the families just decided they're going to have biological children. Another family, I think, went to international adoption. And then one case, the family closed. She had adopted a sibling set already through foster care, was coming back to adopt more kids, and then one of the adopted kids in the home had pretty complex medical needs, and she realized her plate was full, so she decided to close her file. Another one was due to inactivity. So in our state, we have the option of charging fees, which I know is, I guess, not the common across the nation, and so some of the private agencies that do foster care and adoption work have fees to work with us. We have an optional fee of $1,500. However, at the time when this family applied, it was not optional, but you could apply for like a fee waiver, and we denied their fee waiver because they had significant income, and so that's why they ended up closing or went on hold to save money, and then we kind of never heard from them again, despite kind of frequent follow-ups to kind of get them to engage again. One family was a kinship family, and she really was just getting licensed to adopt the kin placement in her home. And she started with the state, switched to us thinking it would be a quicker process, and realized that we are actually longer than the state, so she went back to the state because she just wanted to get that done and get those kids adopted. One family was actually a foster parent in another state, came to Washington, wanted to work with our agency, and as a private agency, obviously we have to follow the minimum requirements to become a foster parent, but we can have our own requirements. And one requirement that we have is that every foster parent identifies someone in their circle who gets cleared, background check to kind of be their emergency kind of go-to respite provider or caregiver. And since they were new to the state, they did not have anyone in their circle that could do that, and so they decided to switch to another agency who did not have that requirement. And then one family, they were in our program when we still had that relinquished infant program. They really wanted that infant, but they took in a foster placement, and it didn't work out. The kid reunified, they were heartbroken. So they closed, and I thought one thing they noted in their file, though, was that fostering just really didn't fit for them. The idea of co-sleeping with their kids was really how they envisioned family, and I think they had a biological child that they did that with, and they didn't like the idea that they could not co-sleep with their foster child. So discussion, I think a lot of these families close for reasons that we see all families close for, regardless of race, ethnicity. But I think there are a few things that we could definitely look at to see if there was some inequities going on in some of our policies. One was that one I talked about requiring families to have that substitute caregiver. Is that really needed? Is there something else we can put in place for that requirement so that we know a family has support, but maybe they aren't getting someone in their circle that's going through the clearance process and doing all those things to be able to watch kids in their home. Definitely stepping up and figuring out kind of the kinship versus traditional foster care. There's different needs for those families. And so making sure our program is open to all. And then looking at our fee structure. Like I said, we now have made our fee structure optional, but maybe we need to just get rid of that fee structure completely to make our services more equitable. Limitations. So obviously, I looked at all the case notes from each Each family, obviously those case notes are written from the perspective of our staff, who are mostly white women, and so they may have not picked up on cultural issues going on with the family or why they closed. There's also limited options of what you can check for closure in our system, so those options that were there were like kind of the options you have to choose from. You can't come up with your own reason for why they closed as you tag it in our system. And then I didn't review like emails, so I could have dug really deep because our system will track every email sent to a family based on their email. So I could have looked really deep into these case reviews, and I'm sure I would have gotten more kind of nuanced information, but I didn't have the time to do that. It's really intensive. And then, yeah, like I said, because it's reported by our staff, there could have been deeper cultural issues. So the family could have said, I don't want to move forward with foster adopt, it's not a good fit. Where really what they're thinking was, you guys did not work with my family, you did not understand my culture, so I'm leaving. But what I'm going to tell you is this. So there could be that kind of discrepancy in why families closed. All right, so my survey. I actually had 20 people fill out the survey, but 2 didn't complete it. So I didn't omitted them from the sample. And then I had 1 family that identified as white who completed the survey. And it was very apparent by their answers that they felt jaded or slighted by the foster care system or were using this as a way to like vent, which is great, but it did not fit into my data, so they're not included either. So there were 17 families that fit the requirements of being a family of color and completed it 100%. 14 were married families, 3 were single. I'll say it was only 1 person from the family completing it, but they were reporting on their family dynamic. 14 lived in Washington, 1 in New York State, 1 in North Carolina, and 1 in Florida. 4 worked with a public agency, 14 worked for a private agency, and 1 for a not-for-profit. And I will say for this survey, families could opt into every question and they could check multiple boxes. So for this one, 1 male, 9 female, that doesn't equal 17 because some people chose not to disclose their gender. And then of those individuals, 4 identified as lesbian or gay, 2 as bisexual, 1 is queer, and 7 as straight. And I should say our agency has a pretty big history of working with the LGBTQ community. At any given time, about a quarter of our families identify as such. So those numbers aren't surprising to me, but maybe the folks in the room, depending on who you work with. So who were these families? 4 were current foster parents. 1 was a former foster parent. 11 were adoptive parents through foster care. 1 was an adoptive parent through international means. And then there were 3 families who completed the survey but never completed the actual process of getting approved for foster care or adoption. Quickly, the demographics. Majority of the individuals were Black or African American. 11% identified, or 12% Latinx, about 6% Hispanic, about 6% American Indian or Alaska Native, 6% Native Hawaiian or Pacific Islander, and then 6% Arab American or Chaldean ancestry. And I starred the 29.4% white because all those folks were multiracial, so that's what they were mixed. That was kind of their multiracial identity on there. So they had white, but also they were mixed with something else. That's who those folks are. All right, so I asked folks in the process, were there any barriers in the licensing process, and kind of what were they? So 50% said there was delayed timelines. Communication issues were a pretty high number. Some said no barriers, which is great. 11% reported other issues. So one family said money and language were a barrier for them in the process. Another one said there was issues with trainings and then also disorganization with the agency that they worked in. And then 1 reported that they had issues with the agency not understanding their cultural beliefs and values and norms. And I have some quotes that I think really highlighted that. So the first, due to disorganized agency and language barriers, training is not available in Spanish, and inexperience with immigrant foster families, timelines were delayed. So that really kind of highlights agency not being as culturally competent to work with a family of all families, with all families. This next quote I think is pretty powerful. Foster care is predominantly through a white Christian lens. As a religious minority, it was hard to have our workers understand our values and practices without it sounding inflexible or fanatical. I just think that's really powerful, and I think it ties back to some of the research I had around the foster care system was maybe not set up to work with all families equally. And that last one, I'm not sure that it was cultural, but the communication style of our licensor was a challenge for us. she didn't seem to understand or take seriously our fears and misgivings about interacting with a system that has a history of harming people of color. I can tell you from my work in the African American community around outreach, I hear this all the time. That is the biggest barrier I hear from families around becoming a foster parent. It was like, you go into my community and take out kids at such high rates. How do I know you're not going to take my biological kids if I become a foster parent and that foster kid falls down on the playground like they all do and get a scrape on their knee? Now I have a CPS investigation, and now you're investigating all my kids and taking all my kids away. And they had a real fear around that. Or you've taken my cousin, my neighbor. I'm not even going to touch you guys with a 10-foot pole because I just don't trust you. So then I asked if there's barriers actually once the kid was placed into the home. So about 3 families said there was trust not established with their social worker. 3 said no barriers, or they didn't get that far in the process to experience a barrier. They never got actually licensed and placed. 2 said there was lack of support from their social worker and or the agency that they worked for. 2 said that they reported difficulty in getting chosen for placement of children. And interesting, one of those families, she said she was never considered for white children, which I thought was a very interesting thing. She said as a black woman, she was only sent black kids, and she was never sent kids of other races for placement options. So that's, yeah, I thought that was really interesting. And then 1 said there was issues around cultural values and beliefs and norms, and 1 reported communication issues. So that's the quote I said. There's a double standard. White kids aren't placed with black families, which is kind of interesting. Kind of goes like the opposite of what you think, but that's interesting. Social worker refused to take my calls, which affected all parties. That's horrible. Like, how can you do social work and support a family if you won't even accept their phone call? And then the last one, communication styles were not in sync and led to misinterpretation if we needed support. So it goes to that support issue. And then I asked specifically now, so before I just asked what were your barriers, I didn't bring in race or culture or ethnicity. Then I kind of asked, do you think that played a factor in any of the barriers that you stated previously in the survey? And I think it's great that a majority said no. That's huge. But the fact that 6 said yes, 35%, that's still a huge issue that we need to figure out and work on. So 1 family said, in our culture, you speak when directed and offer questions, answer to questions, but not always outright express your needs. So that goes back to kind of a cross-cultural communication issue. And then this one, I'm still trying to interpret it, but I wanted to put it in here because I thought it was interesting. I think there was actually less support as a black, Hispanic, biracial family from black state social workers. This was really shocking because it was a sister girl lack of professionalism, an assumption that we could be taken advantage of, asked to do more than initially asked sort of thing. Still trying to dissect that, but I think at the end of the day, I think the assumption is if you're black and you have a black social worker, then they're automatically going to understand you and get your culture. But I think that's not always the case, and we need to make sure, even if there is a match in culture, that we're making sure that our social workers still have the cultural competency to work with all, because black families aren't monolithic, as we know. So then I asked, how many social workers did you work with in your process? 4 worked with only 1 or 2, and 13 worked between 3 and 5. And I did ask if you worked with like more than 5, and no one did. So that was the max that families worked with. And then I asked, did at least one of those social workers match your kind of cultural identity? And 7 said at least 1 social worker did, and 10 said they did not. And so I asked, do they think having a social worker that matched their cultural identity, did that matter? Positive quotes. A woman of color guided us through the home study and made us comfortable in areas we needed to disclose about family members. We African Americans could identify with these issues better. Another one said, some of the social workers were the same race as my daughters, and they were extremely helpful. White social workers seemed less invested in the case. And the last one, yes, I believe the organization and social workers wanted to support the need for more foster adoptive parents who match for children in foster care. Some that said it had a negative impact. My foster child and I are both people of color, but we aren't the same race. The white caseworker had no idea how we were dealing with prejudice and racism. I'm considered a model minority and my foster child is black, there is a clear distinction on how differently we are both treated. So it kind of goes to a cultural competency issue there. It certainly had an impact. None of our social workers had even met people of our culture, religion before. And then the last one, I believe our experience had a negative impact on the process, so much that we quit the process. I believe that a white couple been in the same situation as us, there would have been more flexibility. So this family had some barrier come up along the way, and they believed that if it was a white family, the agency would have fought or done something to bend the rules or whatever to get them through the process, but instead they weren't allowed to move forward in the process. And then I got some other quotes that people are like, maybe, or just I thought were interesting. It may have, the social worker seemed very pleased that my son would be in a family that looked like them. This one, the mandatory course on adoption across race was an awful experience, not because of anything the agency did, but because of the bigots who were looking to foster. I was floored by how insensitive and naive many of the white parents to be. I think that's hugely powerful. And just show, and I think it talks about support and needing to be around other foster families that kind of look like you, and going to every training and you're the only person of color in the room, I think over time gets to families of color who are in the fostering process. I think that highlights that. And then the last one, I don't think it necessarily had a direct impact, but we are always looking for connections with other people of color. And then at the end of the survey, I just said, anything else you want me to know? And so these are some of the highlights. Less classes on race and identity for families of color. And I think this goes back, this is one of our agency's families since we had that required training, I'm assuming. More focus on connecting families of color within the same agency. The social workers I interacted with were great. There could be more recruitment focused on families of color, given that children of color make up a disproportionate number of children in care. Have a good understanding of the fears that we may have about the system. So I think that goes back to some black families just have a big distrust of the system and they need their social worker to understand that process if they're getting licensed. And then hire more staff of color that represent the kids. All right, so once again, delays and kind of timelines were the biggest issue for these families. Communication, rapport, and trust was also mentioned several times. And I think my biggest conclusion from both the survey and the case reviews is that unfortunately there's just bumps in the foster care adoption process that every family is going to experience, which is part of the system. But for families of color, they're dealing with the normal barriers and delays, but then they're also dealing with delays kind of related to their status as a person of color, and it's kind of that intersectionality issue where they're kind of they're getting double the barriers than other families going through the process due to their kind of culture, and that's, I think, the biggest highlight I saw from the data. And I think it's also important, not all families face the issue related to their race or culture, which is promising, I guess, to see. Limitations really quick, obviously the survey, so the case reviews and the people who completed the survey are not the same families, which has been really cool to kind of see that. Based on some of the answers, I know some were the same, but a majority were not. Obviously, there's a low number of families in this study, so it's not necessarily hugely generalizable. Majority of the families came from my agencies, and then I think the hard part is it's really hard to tease out, was it just a delay issue just because of the delay issue, or was it related to the family's culture or racial identity? And I think that's the hardest part of this is not being able to tease out. And as some of the families said, I think it may have been a factor. I can't provide evidence, but I'm not sure. So it's kind of that idea of probably, but I don't know, which is hard to kind of tease out the way I did the data analysis. So quickly, recommendations for our agency and for anyone really working with black families in the process. I think training for all staff, as it was pointed out, some people had issues with social workers who had the same kind of cultural background as them. So figuring out a way to make sure staff has cultural competency for all staff and not just singling out the white staff to go through training around this stuff. Hire a cultural consultant who has a kind of an expertise in foster care and adoption to meet with your staff to kind of check in and kind of do case consults when you're working with families of color, just to see if you're missing anything from your own kind of cultural lens. And I'm happy to say Amara is in the process of doing that, which I think will be a huge help for our staff as we license more families of color. There was a lot of feedback about training, and I think and this is going to be very internal since we have that training around race and culture, really modifying that training so that families of color's experience is being validated in that training. and just making it more inclusive for the families in the process. And I think we just do a better job of reviewing processes and timelines to see if our families of color in general are taking longer to get licensed and other things, to see if there's any other barriers coming up that didn't come out of this study. We need to increase the knowledge that we have of working with kinship families. We don't work with a whole lot, but we're seeing more and more lately as our state is really doing a big push to get kinship families licensed, and so we need to make sure our agency is ready to work with the unique needs of those families. Our financial barriers, I think we need to lower those or really just reduce those. Increase the staff, the diversity of staff, and then create a support group for other families to connect. I think that was a huge theme too, is families of color who foster or adopt feel like they're the only family of color doing that. And so really creating a space for them to see other families that look like them work doing a similar path with foster care and adoption. I think I'm probably over time. So quickly, I did an evaluation, and the only way I could do it, since I haven't implemented any of the recommendations yet, I did this presentation essentially for my clinical staff, so our team of 17 social workers at Amara, and had them complete like a pre and post test. So like, how confident do you feel before hearing my presentation around the importance and the need for more families of color? And so a lot of these went up after the staff heard my presentation, so they increased their knowledge of the need for more Black families, barriers faced by families of color, some of the issues related to culture that are holding families back. That one is really need for cross-cultural communication, but I couldn't fit that up there, so need for that. And then it's importance of really making sure you have family-specific support based on that family's culture and how they identify specifically. This one didn't move a whole lot, so it's kind of their confidence to work with families across cultural lines. This didn't move a whole lot, but I'm not surprised since they only saw my recommendations and actually nothing implemented yet. So it makes a lot of sense that these did not move a whole lot in the pre and post test. References. So I think, what did I learn in the process? So as I stated, I had a job switch in the middle that was not of my doing. And I think as far as managing up, I feel like had I known about managing up like a year and a half ago, I probably could have saved my position because I got to have my old supervisor. I could have given her the tools to talk about what the importance of my work to our executive director, who ultimately decided my work was not needed. And so I think there was just, he didn't understand what I did. And so if I would have managed up a little bit better with my old supervisor, I think I could have maybe shown that a little bit better to him and to senior leadership at my agency. So I just love that phrase. I'm going to be using that all the time moving forward. The idea of managing up. And then for me, I have never been a supervisor. So like during this process to learn about transformational leadership at the same time becoming a supervisor for the first time, I'm able to implement things I'm learning like hands-on, like in the moment, and kind of helping me craft what my supervisory style is going to look like as I gain my skills as being a supervisor. So thank you.